is Diabetes Awareness Month. National statistics show about 10% of the population has been diagnosed with the disease. News 18's Brittany Werner tells us the risk associated with diabetes and how some types can be prevented.
According to the American Diabetes Association, nearly 30 million adults and children are living with diabetes. So prevention and control are key factors for people living with this disease. Dietitian and diabetes educator Jennifer Anderson shares the differences and the types of diabetes that can occur.
Type 1 diabetes, often diagnosed in children, but doesn't necessarily have to be. But their body will stop producing insulin. Type 2, those tend to be more in the adult range when they're diagnosed. Their body is still producing insulin. It's really just being resistant and not working effectively.
People with diabetes have to check their blood sugar levels every day, sometimes more than once. Anderson says the various factors that can put you at risk for receiving diabetes are excessive weight, lifestyle habits, and if the disease runs in your family.
If you know that you have a family history, then that's definitely something that we would want to be even more proactive to help prevent type 2 diabetes. Type 1 diabetes is really not going to be a preventable disease.
The treatments vary for the different types of diabetes. Type 1 recipients have to inject insulin to control their blood sugar, while type 2 recipients can often control blood sugar levels through diet, exercise, and oral medication if needed. Without proper control, the long-term effects of elevated blood sugar levels can lead to serious damage in the eyes, heart, kidney, nerves, and feet.
This is why diet plays a major factor in controlling those blood sugar levels. If you're unsure as to how much you should be eating, there should be no more than a third of everything on your plate.
So carbohydrate is what affects the blood sugar level. If we are really just not aware of what the carbohydrates are in the diet, if we're eating large portions and really even sometimes small portions depending on the medication and that dosage, that's where we can have those extreme highs and those extreme lows.
Anderson says the best ways to prevent diabetes or prevent further complications for someone who already has diabetes are the same tactics. Practice healthy lifestyle choices by exercising and eating healthy. Brittany Werner, News 18.